Okay. One, two.
Hello everyone, I'm SB Major and thank you for joining us again this week for the new American Neighbors program. Today for my program I have some important information that will be of interest to you and to your family, so please watch the interview. Today we are going to talk about the important topic of health insurance, and I have invited someone from Connect Aurora, the program manager, to talk about the health insurance. Welcome to our show, Alison.
Nice to be here. Thank you.
Yeah, can you tell us about yourself first before we go to different questions that I may have?
Thank you.
Yeah.
I'm Allison Somerton, a program manager at Connect Aurora. Connect Aurora is a nonprofit organization that provides in-person assistance with health insurance enrollment for Connect for Health Colorado, Marketplace Insurance, Health First Colorado Medicaid, and the Child Health Plan Plus program that we call CHIP. Connect Aurora is a program provided by the Aurora Mental Health Center, and today I'm going to focus on Connect for Health Colorado Marketplace Health Insurance because we're in open enrollment.
You said you assist with Connect for Health Colorado Marketplace Plan, correct?
Yes.
So what is Connect for Health Colorado first?
So Connect for Health Colorado is the official Colorado marketplace to buy health insurance. It is the only place that you can get financial help to help purchase health insurance. In addition to a shopping website, Connect for Health Colorado offers a statewide network of assisters and brokers to help people choose the plan that's best for them. Connect Aurora is one of many statewide nonprofit organizations who receive grant funding from Connect for Health Colorado to provide free in-person assistance with health insurance, with questions and application assistance and enrollment. We provide assistance in English, Amharic, Arabic, Karen, Burmese, and Spanish. We also partner with the Colorado African Organization and the Asian Pacific Development Center to provide assistance in more languages.
Awesome. Who is eligible for Connect for Health Colorado Marketplace Insurance?
So all legally present residents are eligible to buy Connect for Health Colorado insurance, including people who do not get health insurance from their employer, people who are self-employed, and people who earn too much money for Medicaid and they don't qualify for Medicaid. Refugees, immigrants, visa holders, and people who do not qualify for Medicare are all eligible for Connect for Health Marketplace insurance.
For Medicaid or CHP Plus, if one is eligible, one can get any time they want. But what about Connect for Health Colorado insurance? Can we get any time we want?
No, actually, and that's really important that you mention that. One of the reasons we're here today is that Colorado, Connect for Health Colorado Marketplace Insurance has an open enrollment period where that is really the only time that people can select or change their health insurance. And the open enrollment period is November 1st through January 15th. And if you want insurance by January 1st, you need to enroll by December 15th. So just the key date is January 15th is the date you cannot enroll after that. So customers are eligible for special enrollment periods if they lose their employer insurance, or if they earn too much money for Medicaid, they lose their Medicaid, or they lose their employer insurance. That opens up a special enrollment period for them, and they can enroll in Marketplace at that time. We call that a life change event.
Listeners, point to be noted, if you are not eligible for Medicaid, you still can be insured through Connect for Health Colorado Marketplace. So that has already been begun from November 1st until January 15th.
Right.
So if you have missed anything, please keep in mind to be enrolled for this insurance. Can I get So, is financial help available? What if I cannot afford marketplace health insurance? What other health insurance programs are available?
There are several health insurance programs available depending on a family's income. For people with low income, there is Health First Colorado Medicaid, which has no premiums. There are no month premiums for Medicaid, and families with children who earn too much for Medicaid, their children might be eligible for the Child Health Plan Plus program we call CHIP. And CHIP has an annual enrollment fee, but no monthly premiums. The enrollment fee ranges from $35 to $105 a year, depending upon how many children in your family and what your income is. Adults and children with income above the Medicaid levels are eligible for premium tax credits with Connect for Health Colorado. The premium tax credits are the financial assistance that enable people to lower their premiums. Many people don't think they're eligible for financial help for Connect for Health Colorado, but in fact, a family of 4 earning up to $103,000 a year may be eligible for financial assistance to help reduce the costs of their marketplace health insurance. So we encourage everyone who buys their own insurance to explore whether they can get financial help on Connect for Health Colorado.
So you see, Alison, my employer provides health insurance, but I was told that it is more affordable on Connect for Health Colorado. Is that true, or can you talk more about that?
There are many affordable plans on Connect for Health Colorado. However, if your employer provides a plan that meets certain standards for you and your family, you're not eligible for financial assistance to help you purchase a Connect for Health Colorado marketplace plan. If your employer plan does not meet those certain standards, you may be eligible for financial help to buy a marketplace plan. And that's why we encourage family members, if any questions about that, to call us at Connect Aurora at 303-923-6519.
Actually, who can buy health insurance on Connect for Health Colorado? Who is eligible to buy from this marketplace?
Yeah, so anyone who's a lawfully present Colorado resident can get Connect for Health Colorado health insurance. Even when there are people in the household who are not lawfully present, all the people in the household who are lawfully present can get marketplace health insurance.
Colorado established the Connect for Health Colorado marketplace when the Affordable Care, or we say Obamacare, right? So Obamacare has faced some political challenges that we know. So is Obamacare going to stay or will be gone?
So there have been many proposed challenges to the Obamacare program, but no changes have passed to change the provisions. Especially all the key insurance reforms are still in place. And while Congress did remove the penalty for not having health insurance in 2019, it's really important that everyone has health insurance, because health insurance provides free preventive health services and helps cover unexpected medical costs. So we encourage everyone to have health insurance.
Awesome. So just take an example. I'm in the US on a work visa. Do I qualify for marketplace health insurance and any kind of financial assistance?
Absolutely. If you are eligible to buy marketplace health insurance, and if you meet the income requirements, you're eligible for financial assistance as well.
Oh, awesome. Thank you. I'm taking an example. I'm married back in my country, okay? But my wife does not have lawful status. Thus, I'm giving a scenario to help the listeners understand.
Sure.
How should I complete the Connect for Health Colorado application, and how should I file taxes? So there are two things, like to complete the application and also to file taxes. So can you explain more in detail?
Absolutely. So to apply for a marketplace plan with financial help, families need to file as a tax household. So if your wife is in your tax household, you will need to include her in your application. However, because she is not living in the U.S. or not a legal resident yet, you do not have to provide any information about her eligibility, since you won't be applying for health insurance for her, just for yourself.
Oh, okay. So why do I need health insurance actually? Why do I need health insurance then?
You know, none of us really plan on getting sick or hurt. As a matter of fact, we hope that we don't get sick or get hurt, but life happens. And many people, most people, need health care at some point. But did you know that health insurance costs are really very expensive? That if someone breaks their leg, it could cost as much as $7,500 for an emergency room visit, or the average cost of a 3-day hospital stay is $30,000. And cancer cost and cancer treatment can be hundreds of thousands of dollars. So it's really important to have health insurance which helps cover those unexpected illnesses. But in addition, health insurance also covers free preventive health services and checkups, which are also important for staying healthy.
Oh, awesome. Can you also remind our listeners that you talked about the enrollment period? So can you again repeat the same message to the listeners?
Absolutely. There are 4 things I really
Okay.
would like listeners to remember. The first is that many people don't think they're eligible for financial help to buy health plans. And again, for a family of 4, you can earn up to as much as $103,000 to qualify. So if you have any questions, please give us a call at 303-923-6519, or go to Connect Award and make an appointment to meet with someone in person who can help you see whether you are eligible for financial help to buy a plan. The second thing is, plans change every year. This year we have a whole new health insurance carrier and a lot of new health insurance plans on Connect for Health. So we really encourage people to shop to make sure that they're getting the right plan for them. The third thing is that you need to enroll by December 15th if you want January 1st coverage. But the most important date is that the end of open enrollment is January 15th, so you need to enroll in a plan by then. And then the fourth point is that all plans include preventive health services, cover for emergencies. So it's really important to get covered. So come on in and we can help you choose the best plan that meets your family's needs.
So after the enrollment period is done, how long does it take to be approved to know that the family is eligible for the Connect for Health Colorado insurance?
So when a consumer comes into our office, we help them with the application, and in many cases, you can actually complete your enrollment at that point. And then what happens is that we'll give you all the information about your insurance plan, and that you can either get the payment information in the mail, or you can actually call your insurance company and make arrangements to pay for them. You need to pay before the end of the month for your coverage to begin the first of the next month. So in other words, if someone comes in January 15th, we would get them coverage for February 1st. If someone comes in before December 15th, we can get them coverage that starts January 1st.
Okay. So can you talk in a very specific way how the people be qualified for Medicaid? And if they are not qualified Medicaid, how this insurance pushes them for any kind of medical coverage? Can
Absolutely,
you talk
absolutely.
Yeah.
So again, if a consumer comes into us and they're an hourly employee and their wages are less than $16,000 a year, most likely they're eligible for Medicaid. And our team members can help them apply for Medicaid and enroll in Medicaid.
Yeah.
If their income is closer to $17,000, they are more likely eligible for Connect for Health Colorado Marketplace Insurance. In that case, we will apply for financial help to help them apply for Connect for Health Marketplace Insurance, and they would be approved, and we'd help them choose. There are many plans on the marketplace to choose from, and we'd help them select one that meets their needs in terms of where they like to go to a doctor and the hospitals they'd like to visit. We'd help them choose a plan that would meet their needs and their financial needs.
So this is a really good point that you brought up to know more about Connect for Health Colorado. And as you said, the enrollment period has already begun, right?
Yes,
From
absolutely.
November 1st.
Mhm.
So what are the things that you have been doing to advertise this Connect for Health Colorado insurance, or we say like to get insurance from the marketplace? Because most of the communities, they don't know much about this marketplace.
Well, that's why we're here. So we're
Okay.
hoping that
this is
you
one of
can,
the ways,
this
right?
is one of the
So,
ways. We're hoping
and
that you
what
can help
are
get the
what
word out.
are the other ways that you have been?
So we do radio programs.
Radio program.
We also work with Colorado African Organization as well as the Asian Pacific Development Center,
Asian Pacific Development Center.
And
Okay.
the Colorado Alliance for Health Equity and
okay.
Practice,
Mm-hmm.
and the Colorado Refugee Wellness Center.
Okay.
We work with those organizations to get information out through their health insurance, well, not actually, they're community navigators. We also post a lot of information on Facebook. We have a Connect Aurora Facebook page as well.
Oh,
And by the way,
okay.
on that Connect Aurora Facebook page, you can meet all our sisters. We
Yeah.
have a video of all of our sisters on that as well. We also have a bus ad. We also have ads in the Aurora Sentinel, and we work with Connect Aurora as well as Connect for Health Colorado to put information about our services on their website.
Wow, it is loud and clear that you have advertised to make people understand more about this, right? Connect for Health Colorado. Is this marketplace only for refugees and immigrants or for everyone?
It's for anyone in
Okay.
Colorado who needs insurance. And I'll repeat, it is important to remember, it's for people who do not have employer insurance.
Mm-hmm.
And it is for people who are not eligible for Medicare or Medicaid. So in Colorado, about 7% of the population don't have employer insurance or aren't eligible for Medicaid and are eligible for Connect for Health Marketplace Insurance. And in Aurora, in the Aurora, Glendale area, that could be as many as 8,000 people still uninsured who are eligible for
Oh, okay.
Marketplace. So it's great to be here to help get the word out.
Awesome, right?
Yeah.
Because our listeners are listening about this, and then if they haven't thought about the Medicaid, if they are not qualified for this is the best opportunity to be enrolled for the health insurance, right?
Yes, and
Yeah.
so we need to get you in
Yeah.
between November 1st and January 15th.
January 15, right? So can you also tell or repeat what are the requirements that they have to take while going for the enrollment?
So if someone comes in for enrollment, they need to bring their identification,
ID, or
ID.
driver's license, right?
yes, a
Okay.
driver's license or their green card,
Oh, okay, for to
or-
know their status. right?
correct, and
Okay.
we need social security numbers,
Okay.
and also a pay stub, so we can help you estimate what your income will be for the year.
Okay.
And that's basically what we need. We need that for every family, every person in the family. So if you have a mom and 2 kids, we'd need social security numbers for everybody in the household, plus mom's paycheck, so we can help estimate what the income is going to be. And that's what we use to start the application.
So you don't need bank statement, do you?
We don't need it.
You don't
No,
need, but
can-
you need the pay stub if the family members are working.
If the family members are working, we need the customer's best estimate of what their income is going to be for 2020. So your financial assistance is based on what you believe your income is going to be for 2020. For Medicaid, your application is really based on what your monthly income is. But for Connect for Health, we base your financial assistance based on what your annual income is going to be.
Okay. So, who can come to the center for enrollment? Head of the household or every member of the
Not everybody needs to come. It's
family?
usually going to be whoever's going to be doing the application, the head of household, either the mom or the dad. One other thing it's also important to bring with you to your appointments is if you have any specific medical needs like medications or doctors you like to make sure that you can see, bring that information so that when we look at the plans available, we make sure we get a plan that covers all of your health insurance needs.
Oh, okay. Also, Alison, as you are here with us today, can you talk about the premium tax credit that the family gets and where they can get the deduction while doing the tax return? So, can you talk about if you have?
Absolutely. So when an individual comes in, they've applied for financial assistance, and what the financial assistance, they can either take it each month, month to month, and that we call that an advanced premium tax credit. And in that situation, the federal government sends the insurance company like Anthem or Kaiser or Cigna or Bright Health, the federal government sends that portion of financial assistance to the insurance company, and then the consumer would pay their portion. So if their premium was going to be $800 for a family of four, and their portion would be $400, the federal government would pay $400 to the insurance company, and the consumer would pay the other $400. And they would pay that each month, and then at the end of the year, Connect for Health provides a statement about how much insurance they received, tax credits they received, and then they will report that on their taxes.
Oh, wow. That is good. Recently, it has been known that if one is not insured, they are not going to pay the penalty. But last year, they had to pay the penalty if they were not insured.
That's
so, do you know the difference? Why that is happening?
Well, the penalty was part of the health reform law called the Affordable Care Act to help encourage everyone to get insurance. Because if not everyone's insured, that actually increases the cost of insurance for everyone if not everyone's insured. So if someone's uninsured and they go to the hospital, that hospital has to provide care for them, but that raises the rates for everybody else. So to have to make it more equitable, the law required everyone to have insurance. However, after several years in, Congress removed that penalty, so there's no longer a financial penalty to not having insurance. But as we've talked about, it is really important to have insurance to cover those unexpected medical costs. You never know when you're going to get sick, so it's really important to have health insurance that can give you coverage and help you access health care without worrying about high medical expenses.
Oh, okay. Alison, refugees and immigrants are the victims of the identity theft, or sometimes they don't easily give their information. You know that, right? So for this enrollment, people give their information. Is that safe to give their information that they require?
When an individual comes in and applies for health coverage, we literally help that consumer enter their information on the computer and Connect for Health, and it's a very secure, and they take privacy and security very seriously. We give the consumer back their cards so that they keep it at all times. We just put the numbers in the Connect for Health Colorado website. There are times when a consumer might need to copy that and provide a copy of it to Connect for Health. In that case, we literally will just scan that in and upload it to the Connect for Health Colorado website. And again, we don't keep any of that information. That we give the consumer back the copies and the card, but that information is loaded onto Connect for Health website if needed. It's not always needed.
Oh, that is really a safe place to keep.
It is.
Because if you are not keeping anything, if you are uploading on the system, means it is gone, means you have nothing to keep, right?
And I just want to reiterate, Connect for Health Colorado takes privacy and security very high priority, and so all our procedures require that we just only put in the very essential information, and the consumer walks away with all of their cards and their copies of their identity.
That is safe. Yeah, thank you for that, for explaining in detail. Sometimes what happens is like they are not sure if some of the real medical, like if one is going through the surgery or one is having a regular checkup, one is having a chronic disease. Does this insurance cover all, or there are portions to be covered and others are not? So how is it working?
All Connect for Health Colorado plans cover 10 essential health benefits, which is everything from hospitalizations, surgeries, x-rays, maternity and newborn care, child well visits, adult well visits, and preventive services like immunizations, and for women it would be mammograms as well. So all 10 essential health benefits are covered on marketplace plans. There are reported stories of people not buying Connect for Health Colorado marketplace plans and maybe buying a plan that doesn't meet the federal requirements, so they might not have everything covered. But all the plans on Connect for Health Colorado are required to cover the 10 essential health benefits, and they're very comprehensive plans.
So it is different from copay, right? They pay the premium, and premium because of their monthly premium, everything will be covered.
Yes.
Yes.
As long as they pay their monthly premium, and all plans have premium payments as well as co-payments and deductibles. Correct.
So one question, the enrollment period from November 1st to January 15, as you said. So if one wants to be enrolled for that and comes later after the enrollment period is gone or closed, can one be insured?
Only if they have a life change event, a major event, such as losing their employer coverage, losing Medicaid if their income goes over Medicaid, or they get married or divorced, or if they move to the state, or if their young adult on their plan becomes over age 26, they're no longer eligible for their parents' plan. All those events are what we call life change events, and they open up what we call special enrollment period for that individual or family.
So we have come to the end of our show today. So final advice, can you share your phone number one more time, and also the centers if you know, so that the listeners will start calling to you?
Absolutely.
Yeah.
We're at 303-923-6519, and consumers can also go on to connectaurora.org, and there you can also find all the locations that we provide help for people with health insurance.
Thank you so much for listening today. Today's topic was very important, health insurance, and we were not only focusing on Medicaid, but we were focusing on Connect for Health Colorado. It was a very important topic for you and for your family, but if you have any questions furthermore, please give us a call. As she mentioned, the phone number for any issues or anything that you wanted to know more about. So thank you for coming to us and then explaining in detail about the health insurance.
Nice to be here.
Yeah.
Thank you.
Thank you to have you here.